Very well, so we're going to start. Hello, Kwekwe, hi. My name is Gabrielle Legendre, and I'm the facilitator for the Community of Practice for Cultural Safety in Health and Social Services. We are very happy to have you with us today for this activity open tool, which marks the start of a process of reflection on evaluation in cultural safety. We had another activity at the end of the program about this themes. We're going to talk about the subject in our activity today. So the Observatory of Réalité Autochtone Urbaine that is with us today, that has conducted a rigorous monitoring and evaluation of projects funded under the support program of the MSSS introduced in 2021 through analysis of initiatives deployed in Native Friendship Centers from 2021 to 2024. This study sheds light of persistent barriers, also promising practices and innovative models that strain the cultural securization of frontline services for urban indigenous populations. So without further ado, I'm going to give the floor to Jolie Gira and Audrey Penseneau. They're going to introduce themselves and present the fruits of their study. Also, I could give you the report that is in French and in English about the conversations during the presentation. So Julie and Audrey, good presentation. Thank you, Gabriel. So hello, Julie. Dif different ways to say hi in the different native languages. I'm so happy to be here with you today. It's a beautiful opportunity that the minister has given us and also the committee of practice to be able to present the evaluation works that we have done regarding the process of evaluation of the services of well-being. I'm out here with Audrey. I'm going to let her introduce herself. She is a beautiful partner for this movement. Hello, everyone. Thank you for being here. I'm Audrey. I'm an advisor in evaluation of programs and services in the Observatory of Indigenous Realities. So 7 years I've made part of the movement of Indigenous Realities. So I'm very happy that we can present the results of this process of evaluation that lasted many years. So from now, I'm gonna go ahead and share the presentation. Can everyone see your screen? I hope you can. I see Karen smiling. So as I said, we're going to present how the program of finance for the program of first line for the indigenous population. So how we evaluate it, as Gabriel was saying, so the accessibility, the strength, the collaboration, the challenges. And we're going to conclude with certain reflections. We have given this report with the minister in December. So if you know, at the end of the meeting, the versions, French and English version of this report. I'm going to ask you to slow down a little bit. Thank you. So if I go on, what we're going to talk about today in the agenda, we're going to present the movement of friendship centers in Quebec. We're going to talk about the background evaluation approach. We're going to present the results of the evaluations. We had 4 axes they were evaluating in the procedures in the clinic in the movement. So Indigenous clinic, and we're to conclude with the collective learnings, conclusion, and with a period of sharing and discussions. So what is the Native Friendship Center movement? For those who don't know it, what do we do in Quebec? We're in the movement that is national, so it's everywhere in Canada. In Quebec, specifically, we group this 14 cities that receive friendship centers or service points. You have the logos. These friendship centers that are working since the end of the 60s are well anchored in the cities for a long time in Quebec. With the time, we decided to regroup together, which brought to the creation of the regroupment of Native Friendship Centers. There is a collective voice of the collectivity of friendship centers in Quebec. At the same time, there is a society in the buildings that was funded that comes to allow the access to the resident for Indigenous students in the cities, mainly in Trois-Rivières and Sept-Îles. So this is a beautiful movement of friendship centers. We in the Observatory of Indigenous Realities, we are here to develop a evaluation culture of projects and research to have the Indigenous matters in Quebec. We have here the map of the Native Friendships Center movements that it allows to individualize where are the different friendship centers in the province. So what is great with the Native Friendship Centers, that there's a common mission that really wants to improve the quality of life of Indigenous peoples in the urban areas. So it's a movement that is anchored in on the need of Indigenous peoples in the urban areas. So you have the list here. It's interesting because it's a model of auto determination, Indigenous determination in the urban areas, as we see that we're offering services that are respond to the needs regarding the worries that Indigenous peoples live in the different cities. Trois-Rivières, Sept-Îles, Montreal, they have the different particular realities regarding the Indigenous population needs services. So this is one of the strengths of the movement is to be able to adapt. Each center is going to answer to the needs of the area in the cities and Indigenous populations that they're serving. The culture is at the heart of the actions of the friendship centers, which is distinctive in the cities. And each one of the centers has a responsibility through the members to respond to their needs and their aspirations. So the group, their mission, as I was presented it, is to put these centers together that want to defend the rights and interests of Indigenous citizens in urban areas. So this is the collective force that is translated in this group. We contribute to tangible solutions and public policies that promote Indigenous wellness. We implement innovative and proactive strategies, and we support the friendship centers in their missions. So, in a part, the observatory was created in 2022, which brought us to have a mission to gather, understand, and share knowledge related to urban Indigenous issues, focusing in actions on using First Nations and Inuit knowledge and expertise for the benefit of the society as a whole. So we are in the actions, so together, the knowledge, the data that exists about Indigenous peoples, we see that we are the subject that plus is studied, but often the eye has only one side. So is the role that we're playing is to give proof about Indigenous realities and also to have the urban dimension. We want to go and understand what their gaps, lack of information, and finally, we want to share these results as we're doing today to make the Indigenous matters more visible. We have 4 key research areas that come precisely from the consultations that we have done with Indigenous peoples in urban areas, with the friendship centers, with the elders, also with the universities in Quebec. So our main key areas are culture and identity. So that is multidimensional, which is distinctive. The culture of the First Nations, also the health and collective wellness and individual wellness. We see it today. This is what it brings us here together. Also the housing, a perspective that is very different from the habitat. So this is a matter that we have also gone deeper in the observatory, and also all the matters about governance in an urban context. They're about our key research areas. I'm going to give the floor to my colleague, Audrey, who is going to give us the context about the background and evaluation approach in collaboration with the ministry, with the Service of Better Well-being in Quebec. Thank you, Julie. She's a director of the observatory. We have a team, they're researchers, analysis, also in residence. And myself, I take care of the evaluation. We are colleagues collaborating together, but this shows that this makes part. It's one of the important actions of the observatory evaluation, because this answers to concrete immediate needs of the friendship centers. So the context of the evaluation context that we're presenting today was a funding announced by the MSSS in May 2021. Is something that we were waiting for a long time. We were happy to have. The context, we were in the pandemic. There was a consensus coming in Quebec about the importance to act. We needed to have results. That it was also the drama of the death of Dacian Chantran about this new funding. This program that started in 2021, it was very historic because also recognizes the expertise of Native friendship centers and the importance of the cultural, spiritual, collective of health and wellness for Indigenous peoples, something that we hadn't had before. So it was a step forward. The program was well received. At the moment of this balance, there were people in the movement. Also important to say that the friendship centers were in the mission to offer services that will support the well-being of their members, not always with the good means. There were 5 Indigenous health and wellness clinics. We are using the word clinic to say that it was possible to have a consultation in place, being a doctor, a nurse, or another profession. So we already had things that were working, but were not all of the centers that had the means to develop this kind of services. We didn't have the strength that we have today, but we already had something in 2021 in the context with the creation of the observatory 2022. So we still didn't have the observatory. With the evaluation, it came our way to do things at the research with all the team of the observatory. This came to accompany us. It was an important funding. So provincial evaluation was very important to support the improvements, to continue to make sure what we wish, the permanency of these kinds of fundings. The group is a big team. It's not only the observatory. We have people taking care of services, also strategic development, a team of communication. Please slow down, Gabriel. Thank you. Thank you to our interpreter, Sophia, who is doing a great job. So not only the observatory, but the work group allowed to the Friendship Center to get together to consult and agree. So it was a work that had already been done to really consolidate the mission of the well-being. Is there, of course, there indigenous knowledge in Quebec, but as we are a movement where there are many nations, Inuit, the vision has to be global. Here you have in front of you the vision of health and wellness shared through our movement. It was a vision that is so large. So Indigenous health is the ensemble of the friendship centers. So this quotation that was gathered during the evaluation is very solid. And the aspect in the world about health and social services, we're trying to have a more holistic approach in an Indigenous context. Makes part of the vision of health. We don't need to do any efforts to see and to try to be holistic. The is very natural procedure that comes from people and from the collective. It's actually harder to have common definitions because it's so anchored that it's a challenge. But it's a beautiful step that has been done to define collective health. And this definition was anchored in the theme being Atikamek, Anishinaabe, Inuit, Innu, to build this common definition because the consensus was easier to have indigenous languages that to translate it to French. So in terms of Minopina Dizuin and Atikamek, but these were concepts that include our colleagues, tell you the initiatives that were funded with this initiative. So this anchored in the language and it makes sense this way to see the health and the well-being. We can continue. So provincial evaluation process, first of all, it was validated by the Native Friendship Centers, and also we worked in collaboration to have the evaluation frame is an evaluation frame. The process was respected, the principles, the lines, the, the references that is common to all the movements of friendship centers. You want to read, if you want to, there you could have more information. Since it's a mission of observatory, but also in the base principles of the research of the movement, we give also a lot of importance to the knowledge in indigenous knowledge because there are crucial. So we favor collective and participatory methods in the movement. Is the strength of the movement. We're gonna go maybe not so fast, but we're going to move forward together. So rely on collaboration so that people may exchange. Sometimes they work too fast, and the occasions to be able to share, we have to multiply the occasions to really share and improve and reinforce the capacities in evaluation within the center and our teams. So it's rely on collaborations that enrich us and strengthen our internal capabilities. For the more technical side, clinical evaluation of services, because it's not an expertise that we possess. We had it with Valdo and Abitibi at Iskamek that put it independently, autonomous, their own evaluation services, etc. We have a lot of collaborations that are going to enrich this. And also the listening and the observation. I'm going to give you the floor a few seconds to illustrate how the listening and the observation are anchored in the movement in the observatory. We're trying to have an evaluative approach and of the research based to see and listen. I'm going to do reference to my language. The two main verbs are see and listen. And in French is another thing, the logic is based. It's about the verbs to be. It's our vocabulary, our understanding of the worlds about the listening of the observation. That in parallel with this, I'm still comparing with French. When it comes to divide the world is the masculine and feminine genders. This is how the verbs are going to be. So for one language, it is the language of my community. For us, the vocabulary, the verbs are going to go in function. Is it animated, alive? There's a better understanding, a better way to do the research and to position. In a posture, we're going to put a lot of attention in our presence to observe and to listen what is alive and to try to understand this way, that to try to have knowledge about the questioning. We're in a posture of humility, of sharing and participating. So this brings it to work differently. We are a research team. We're observatory. We are a lot in the field. We're there to work with people because this is how we understand what's going on in our fields and elsewhere. Here, the main page of our report. So, but you have access to this report. The methods that we used. We have spoken about the approach, how we work. Listening and observation was one of the methodologies regarding our evaluation process. Activities of evaluation were possible. We tried to bring them together to regular activities of the group. So the follow-up of a training, consultation, often we're in the action. So we try to do it at the same time so it doesn't become heavy for friendship centers to having evaluation activities there besides the rest of the activities because everyone is very busy. This is a reality, we know it, and need to answer to urgent needs. So respecting this, the listening and observation is one of the important methods. So formal interviews during the process, during the activities, also the follow-up calls, visits in the to the centers where we're always listening to gather information. We had also questionnaires distributed to the friendship centers by season. So to have a portrait about how things were going on in the services of well-being so that we would have more precise data. And also within the group, we had a annual summary of what had been gathered. We consulted documents of our colleagues, of the meetings, etc. We had also interviews, and this is very interesting because important for us to have the point of view of other partners because the collaboration was evaluated. So we had 9 interviews with players in the health and social services networks. Thank you for participating. We're 9 interviews, but 19 respondents answered. So we had interviews in all the regions where there was a Indigenous Friendship Center. And we had sessions of collective validation, players and community of practice in evaluation to make sure that what was happening in the evaluation was a consensus and we could bonify it by all the people that had an expertise and an important experience, a pertinent experience. In our goals, we had 4 goals, is for sure. We're going to present the results today. So to describe First Nation access to individual, collective health and wellness services was one of our goals. Of course, understand urban governance and Indigenous health and wellness. In all the evaluation, it were things that we wanted to understand better, understand the partnerships between friendship centers and institutions of the health and social services networks in which they worked in Quebec, and also highlight practices specific to the Quebec Native Friendship Centers movements in health and wellness. These were the 4 objectives. A 5th one that is not here, we didn't illustrate it because we won't present the results today, is in our goals to reinforce the capacities in evaluation inside the movement that our evaluation activities can contribute to reinforce the capacities and to give more autonomy of evaluation in the center. So in this context, we are working hard with a potential renewal of the funding of the clinic to see how we would be able to improve. This makes part of the works that we will continue to have. So with the first goal that we had all the accessibility, you have here the main services offered in the clinic. We see the numbers in parentheses. These are the number of clinics that offer this kind of services. In the friendship centers, the main, as you see it, is the psychosocial intervention. In the vision, health vision, and a vision of well-being, this dimension is as important as medical actions. All the access to traditional plants and medicines, and on also traditional medicine used in the different friendship centers when we're talking about treatment to improve the health and well-being individually and collectively of Indigenous in the cities, administrative support for members of the movements that are offered and being to go and look for the RAMQ card or other documents for the citizens of the cities that are Indigenous, they need. Also, land research and intervention in nature also is in all the centers. I will be able to come back in the practices that inspired us, but it's very important to show in the ensemble in all the clinics these matters of researching access to traditional medicines, also psychosocial intervention, and the resources and the traditional healing are available in their conception of services of health and well-being for Indigenous peoples. I will come back into detail regarding to what Audrey gave us, told us before regarding the clinic. You have it here in the screen, the creation of each one of the clinics. But what we can say with the funding of the ministry in 2021, we had an improvement and a bonification of clinics and a rapid development. In 2023, these 3 new clinics that emerged. So it was a process that got accelerated that allowed us a bigger accessibility to services that were pertinent when culturally speaking for Indigenous peoples. If I go with certain numbers that could be interesting, more than 2,500 active files in health and wellness in the different friendship centers, Indigenous peoples that come and look for health services within our movement. This represents 12 employees people who work directly in health and well-being, the nurses in their movement, 6 among them who are loan of service. So the relationship of collaboration is translated. For example, in the loan of services, the presence of doctors in 6 clinics, which is interesting because we know of course, that going to doctor is a problem for many cities in Quebec. So all of the clinics, I was saying, have developed a diversity that is pertinent with an holistic approach of health. Something interesting as well, all the clinics have more than one action. There's a diversity of the cultural approach. Each one of the centers goes in this cultural diversity. For example, in Trois-Rivières, we have to serve clients in Benaki, Inuk, Atikamek. In Val-d'Or, we're going to be more with the Cree clientele and Anishinaabe. So this is the strength of our movement to be able to adapt to the diversity of Indigenous nations in the cities. I'm hoping, Sophia, that my rhythm has improved. I continue with the statistics because these are things that are interesting for people. We have seen with the financial support of the ministry, the new health professionals that came to the friendship centers to offer and well-being services. We're talking about chiropractors, therapists, nutritionists. I don't need to explain the acronyms. I believe that here were familiar. Also, the doctors that are present. Inner movement is to 47 Indigenous peoples who come to the centers to look for by a day inner centers. So we see that people who come here regularly, these are people who will be able to evaluate, that will have met the obstacles to go to the public system, and also the complementarity that we offer with healthcare system, and they come and look for us to improve their well-being. Annually, this represents almost 16,000 hours. Even centers that have services 24/7 with the emergency lines. So these are things that are very important that allow to respond to the needs in the urban areas about accessibility. I'm gonna come. It's a limit of we're not gonna go to meet the users. So the collecting data is important, but also the trust with the friendship centers, it's a priority, and we didn't have the time to build how we're going to do things, the collaboration with the friendship centers. But also the workers in the field, even the partners, have confirmed that most of users were people who are not usually served, and they're going to look for services elsewhere to answer to their needs. So it's not services of first line. This really allows a better accessibility and remove the barriers in. And when the services grow up, there are clinics that exist already, but they were able to bonify their services and also their capacity to join new people. Even before that, we're not going to the clinic, but now they have more capacities. We have talked also, they succeeded to join more vulnerable people. So we must not, we were very well documented. There were many barriers to have access to the services for Indigenous peoples in urban areas, and we have gathered many, of course. There are language barriers that are not well understood, and sometimes is their second language in French or in English. So they speak very well English and not French. So the important language barriers and lack of understanding and recognition of Indigenous realities, values, and perspectives of Indigenous peoples. A lack of awareness of available service and misunderstanding. People don't understand where to go, to what services to go to in the city. Also complex administrative procedures. The support, they can go up to have an online rendezvous can be difficult to have a card. So many things, an important portion of the work that is being done. With the culture, mistrust of the services, many First Nations and Inuits with the public services. There is a present a worry that people that had bad experiences, and this has a result in their attitude. It goes to the reticence to go to services, the fear of being judged. This can have a consequence in the for the care continuity. There are many barriers that were seen. The socioeconomical hardship, we have seen it. They can go and help people with transportation. Things are barriers to go the distances when it takes a vehicle. The lack of transportation in certain cities is very complex for people that don't have the means to move. To move, certain services are cut. Sometimes they have to go very far to have an ecography. The lack of services and the frequent moving. Many people, even if they're going to if they're going to go to the clinics, then there's a problem to do the follow up because they don't have a fixed number or a fixed address. So the friendship centers have better tools to come join people where they are. The complex life trajectories with multiple challenges, mental health issues, addiction, legal issues, violence. We really have to act with a sensitivity. Also, the friendship centers are very good and also they have tools to work with these kinds of challenges, the cultural shock. And many of these barriers are the parents that haven't with all of their children that have barriers because of their parents. So be in a global, general way. Then they have consequences of inequalities observing the population, indeed, Quebecois population and the rest of the population. So this will be all of the barriers. So with the other objective that we had, so understanding urban health and wellness governance. As you know, Indigenous organizations, they take part in the management of services offered to Indigenous peoples. And this, for the Indigenous peoples themselves, the inequalities, services for them, this goes also in a process of cultural safety. But the cultural past, a colonial past, affects these structures, governance structures, so don't see that the time has passed. And we still have the story that goes beyond the relationships or in the construction of governance, being Indigenous level or governance from different ship centers. What we could see with the evaluation, the experiences of Friendship Center Indigenous health clinics that are very clear. Guidelines for Indigenous governance. It take the predominance of the organizational culture and the health system that is majority. this relationship of power is respecting this collaboration. So what we have seen, the co-construction, the collaboration, or the governance, or the autonomy, we had in inequality reports to have a co-construction in certain exceptions, certain regions. But the understanding of the system with all of its worries was still reflected in the governance. Concretely, the friendship centers, you have seen it, it works for Indigenous peoples, but the relationship within the services and the understanding of the well-being, it has the reports or have inequalities because the Indigenous organizations had to understand the functioning of the health centers, and Indigenous system wasn't always well understood. There were also worries regarding the governance of data. So for services that would share the information in the Quebec system instead of those that send friendship centers, but how can we have a real vision of what's going on in our intervention field if our data doesn't belong to us? It's not complete. So these are governance worries. How do when we see how the governance works with us is a governance based in processes that we're putting in place with accreditation, but that are based in actors that are also holding the realities, but to bring solutions to these needs. To this is a difference, maybe an equity in the relationships of power translated in the governance models, in the development, and the collaboration. Our way of Indigenous way of doing things, we have succeeded to shine in the urban areas in the services of well-being. We see it, the process of giving services, adaptation of services are adapted to the local population and the administration, the councils. We have also the constitution. So we have a chart of unity and common values. This goes in a collective and a local movement. These are tools that allow to define this Indigenous governance. I'm gonna give you the floor for the item. Oh, it's an important reflection and we continue. We have gathered collective observations in a research project that are related to this and our rules in our terminology. So we haven't arrived at conclusions regarding Indigenous governance in the urban areas, but we have some clues. The collaboration. First of all, I want to underline the factors that have influenced the dynamic of collaboration. They had clinics for more than 10 years. This implicated there was already a collaboration with their integrated center and social services and region. They had a long history of relationship and others that didn't have any at all when the funding arrived. So this really has an implication in the collaboration and the dynamics of how it was deployed. Also, the stability. It wasn't equal everywhere. There are friendship centers where there's a general direction there for many years. For us, this was a strength for the friendship center because to have an experience of relationship of leadership in negotiation tables and in the with the with the long-term partners, it was by experience. So the experience in the organizational capabilities. They had a team of 10 people, others of and a teams of 65 people. Of course, in organizational capabilities, there were 10, 15 people, more or less everyone have straight collaboration with people, so the people dedicated to the strategic development, evaluation. So for sure, the organizational capabilities at the beginning of the funding in the center had an impact. Also, with an integrated center in each one of the regions. What is the implication of the presidents in the process of relationships with the indigenous communities and the orientation as friendship centers? What plays the the positions? We have presented the context, but most of navigation of services, the funding, safety with the partners. I want to say that we understand that we're not going from the same place. It's normal that moving forward and the partnerships are not the same everywhere. I'm sorry. We're not gonna go with, I mean, we had certain pillars of success in the collaboration, many things, many elements that bring the success in the collaboration. One is stability of resources, for of course, is a pillar. The partner decision, the turnover of personnel. This makes partnerships that are evolving very quickly when the positions change or are empty. This is a pillar. The power of decision of the partners are being with that are the most motivated and engaged for the cultural safety. If they don't have decision power and maneuver to make decisions, to bring the changes necessary to be able to offer services that are in the Friendship Center, the innovation, we have different services. Sometimes this implicates to make changes. We must have decision power. It is adequate for these changes. We must have of an openness of doing things differently and a will to learn and to be inspired by Indigenous partners that come with a different vision that maybe don't have the same understanding of health network, but they have a very deep comprehension of health that is very holistic and that also can bring very pertinent elements. So is the acknowledgement of the expertise of friendship centers and all the importance of understanding collaboration and the limits of the Quebec network. We don't need it. We didn't need to create this program if the Quebec network could answer to the needs to Indigenous peoples. These kind of projects wouldn't have been necessary, but is necessary. So there are limits, like the understanding these limits, the autodetermination principle, the also importance of self-determination, but the respect of these principles was very important. Formalization of agreements, when we're formalizing agreements or the way of doing things. So this ensures the durability in the team and creation of a sincere relationship between partners. There are many values: respect, honesty, humility, the trust, flexibility, listening, openness. These are things that came back. We don't have, of course, we have identified many challenges to the collaboration. I won't go here, I won't go on and on forever, but so from the other side of the medal, of course, the complexity of Indigenous world is underestimated. In certain regions, it's very complex. There are Indigenous communities of far regions where the services collaborating with the Indigenous peoples is not as simple. The new person in the position, navigation of services, so liaison, agent. These are not easy roles. We have complex realities, and it takes time and experience. And for sure, this can be a challenge for certain collaboration spaces for the friendship centers to collaborate with people that are still learning in this level. Of course, the expertise of friendship centers wasn't recognized or valued in the regions. It's normal. There's certain regions we had years to develop this trust links. Of course, the co-construction, the partnership collaboration is the idea of the program. We can say is not really everywhere there was the co-construction. Sometimes it stayed very superficial. There are things that can be done in a region and not in another one. So why there's certain rigidities in certain regions? The structures of organizations of integrated centers are very complex as well. So it's a very complex language and sometimes we're talking about different languages, different visions. Also, the lack of workers, of course, vacations bring a problem. Many administration problems that are impeding to develop services. And we have to keep in mind that cultural safety touches the decision and institutional power. What we see in certain regions, and it's normal, there are procedures are still efforts to measure and deploy by the friendship centers to take their place, to be understood their way of doing things. And the reports of inequalities among partners for the funding arrived to one place and not to the other. So there was the funding link of control that could bring a certain control and a report of inequality. Uh, Also, this is a big institution. The Friendship Center has a long expertise, but in smaller teams, so it can be complex. How to understand and collaborate without going to a burnout? So many challenges and work to do, but we have identified pillars, and also I would invite you to read them, identify innovative practices. There are many of collaboration, and in the administration center, also sometimes with health services in the community, with other friendship centers. There are many projects of inspirational practices so that maybe we could show so people can see them. I don't know. I keep very deep in my heart with the general direction of six that came with the ABTP Center with other managers to really travel together and to learn to trust and going together. It was something new, something symbolic, but it between partners. But there was a lot of inspiring initiatives. We spoke about Baldor. There was a co-construction. Even before the financing, they built the initiatives. They wrote a co-responsibility agreement with which one of the partners also shared the evaluation of the process. It was very inspiring. Now we look at the innovative practices that we have mentioned in the report is often resistance practices of going around of rules, procedures, frames that exist in the health network. So this gave us a lot of learnings and reflections on the flexibility that is necessary and the openness to do things differently. It's very important. Would you like to add something regarding the collaboration? if I understand, the details in the report, but also things that if you don't have a friendship center in your territory, because I know that certain communities, we don't have them, there are simple things that can be implemented or can be done and are very interesting and take the time to look around and observe. Amaniweki that has done a kind of surveillance of social networks to facilitate the complaint process. So small initiatives that are not as hard to do, but the innovation in the collaboration allow a better cultural safety for Indigenous people in the services. I'm gonna go broadly in this presentation, but what, how are they different for the well-being? I have the traditional care is in the heart of our services. Concretely, with the complaints, all the centers allow the centers to have the matter of the denomination. We're not talking just for with animals, for example, people can take this treatment or being accompanied with the elders to improve their well-being. The presence of elders is it's very important in the healing because it makes part of the holistic approach. The territory is anchored and is very important in the actions and the collective dimensions to go walk and have interviews with a psychosocial advisor that are being done not in a table but elsewhere. The presence, I was talking about our vision of the evaluation to observe and listen. This brings us the nurses and people to also be in the everyday basis for community activities because it make part of a collective life. And this work of everyday relationships allows a better relationship when we go and look for a service. Our vision of the familiar approaches and the ceremonies that allows the well-being and the healing. Also, the vision, holistic vision, is everywhere, and it's very important. In the characteristics of the common approach, what we have to know the importance of being anchored in the cultures in our services, to consider the indigenous languages. These are practices that allow the success, the possibility of governance, but be able to have an influence in this governance. It makes part of the healing, the well-being of the pre-appropriation as individuals of our own health, be able to participate at collective decisions. These are our common characteristics of the approach of well-being in the friendship centers. And from here, the complementarity role that we have with a health network, this is something that can survive and be done in a friendship center, also be done in the health networks. In a hospital, it will be harder. So there have been the important progress and other practices. Here we are in the concrete activities without also the prenatality projects that are emerging in the different centers. We have all heard about the mobile clinic in the Friendship Center in Nadodian that allows to go everywhere. The services in the territory in Yaganik. These are all concrete examples that are very inspiring and allow us to have a health approach that is complementary to the network that really answers to the needs of Indigenous peoples. Now we're arriving to the conclusion of our beautiful discussion. We did collective learnings because we are learning all together. First of all, what is this health and wellness services that make sense for Indigenous peoples? They make sense. And we're saying this that makes sense that are really allow to answer to the needs, and these services that make sense bring a better accessibility. We believe there are impacts in the accessibility of services to join people who don't recognize themselves in the services elsewhere, so they're going to come to us. There is not a bad door to enter in the friendship center, so people can start by the collective cuisine and finally going to consult a doctor maybe for the first time in many years. It's really a better access. Also, it's important to say that in all the actions that do a reference, navigation, translation, transportation, support, there is a complementarity in the continuity with the health network and social services. It's not separated, that it brings a better accessibility also to other services in the public network because there's a lot of support and referencing that is being done to go to the networks. Also, the indigenous health for indigenous peoples, they have innovation models different of what is going happening in community because there are many nations that are underserved. So we have things that are many indigenous, but with an understanding, with an approach that allows many nations, many cultures, many languages, and I would add many levels of connection and proudness about indigenous identity in the city. There are people who have a very strong indigenous identity, and here in the central, in the different centers, we have the sensitivity to adapt to all of these realities. I would add to this diversity of nations that it becomes a lever to go on for the Quebec network because the communities and the nations, they learn to confront different native nations, and maybe they feel a little bit more comfortable with presume because they have met another that maybe is not a threat. And another innovation element is the diversity of services that we have access in a friendship center. Even if we're talking about clinics in indigenous health, they're not alone. They take all the sense because they exist in a friendship center where there is a dynamic and where there are activities for families, for elders, support groups, and all of this in the sense where in the clinic is integration of all of this. The fact to having the access of a doctor or nurse, this is really innovative. We saw with the barriers in the collaboration, it's not always obvious to speak about innovation, but clinics can inspire for the rest, for the deployment of new clinics. Indigenous clinics have a development that is unique. The development was very fast, and this allowed us to have a lot of common learnings with solid basis for the collaboration with the partners in the network and also within the friendship centers in the collaboration. Make it we have learnings that we can share from one region to the next. So this saves a lot of time and this makes the experience richer and develop unique development. The importance we see it with our clinics that is the most mature, the one in Baldor. So how this co-construction is done in many years. So this deployment has to be partial and come quickly, and being conscious that a relationship starts and can take time. We have evaluated in 4 years, but the history that we have seen it is longer. And we have to be conscious of this deployment, that it takes different rhythms from one region to the next, depending on many factors. That also the financial support from MSSs, not everywhere, not in the same way, made places where there was still no collaboration. So this funding should guide the collaboration, but the collaboration shouldn't depend on having funding, financial support, because it's essential between the health network when they have presence in the territory. What we see, the speed of development and success of services still depends too much on organizational capabilities and the ability to adapt to new frameworks. For example, to have the new codes and to adjust. This brings us to the idea of things that we need to work on. Obviously, government and HSSN players are very valuable allies in influencing decisions and also in breaking down barriers. For example, administration constraints, things that have evolved thanks to the people's involvement. Also, we cannot innovate alone without the collaboration is essential. And we hope that they contaminate positively the rest of their teams. This is very precious. Here we have the follow-up evaluation of the inspiration and the work that we still need to do. I won't talk about each aspect. These are different reflections of these first evaluations that really made us think. Is the follow-up that we aspire, and to conclude, what we can say, the understanding of the cultural safety and also determination and the responsibility. We have to go on with this work to understand and to share the common comprehension from both parties. It's crucial. We are in the first step of this relationship. In the history of the humanity, of the well-being, we're small drops in an ocean, but as we were saying, the support has to become a lever and to make sure to better re-equilibrate the powers of the common comprehension, and to dare to innovate our structures, because our objective is the same, is to be able to ensure the health and the well-being of their population. And this is going, if we have an impact in one indigenous peoples, it's going to have an impact in the rest. Thank you. Do you have any questions? Thank you for sharing with us all of this analysis, the learnings. These are really inspiring results. The methodology, what really brought me something that can be inspiring for members, and all the practices that you have named. And we have seen that in the report. Congratulations for this beautiful work. And we wish you to be able to present the follow-ups of your work. I'm going to open the question period. So Chantal, you can open your mic. Yes. My question, I know that you have mentioned many times that the Friendship Center, the Inuits were also welcoming the Friendship Centers, but we have a clinic, Inuit and Queen Elizabeth, the Quavivik Clinic. Did you include it in your research? No, but I'm going to answer. Our evaluation is focused on the clinic of movement of is a clinic in Montreal of Indigenous in Montreal that is going to receive Inuit clientele, but we don't have. I know there was funding for other clinics, also like Saint Jean, others in Montreal, but our evaluation was limited to the clinic in the movement of friendship centers, the 14 cities. Thank you. Thank you, Chantal. Kevin. Thank you, Gabrielle. Maybe you can introduce yourself when you, so we can. Kevin Meana. I'm charge of projects in cultural safety in the SHUM. Thank you, Julie, for this presentation, and Audrey for and the results also echo here. This it touches our hearts. I could offer parallels with our realities and cultural safety at the SHUM, and we're trying to construct bridges with the Indigenous organizations. We feel what you have described, and it's good to hear that this comes out in the results of the research. I would have 3 points. I don't know if we have the time, Gabrielle. We can start by one and then we will see. The first point, the language barrier that you have described, because we did a research here at the SHUM. So the Center of Research of the SHUM in collaboration with the Research Center, and we have found out that this language barrier is also very present here at the SHUM, mostly when the care team were going to propose services to Indigenous patients that being their first language is not French. Sometimes it's English, but even the English is a little bit difficult, but that's another matter. If it's not either French or English, I was asking myself, the Indigenous Friendship Center in Montreal would have the group would have these ideas. Do they have an Indigenous language interpreters bank? Because from what I have understood, in the system, in the network, each one works in silos. Sometimes we have organigrams or processes, say one person specifically that we can call at certain moments for the inaptitude, another in another center for another Indigenous language. So it's not uniform. Each one does as they can. Would you have a solution to improve this problem? These are complex problems in each city. There is a specific reality. For Montreal, there is a reflection. But in Montreal, but in general, in all the public network, you have many practices that are inspiring, in which you could also inspire yourself, and you could even share resources. If you go under the category of each one, because maybe there's an interpreter that could do the interpretation by Zoom and any other means that are available. We in the friendship centers, they're developing things. This is not all that can give the translation for all cases and needs. I would also say that could maybe, with interpretation of the language, to change our practices. Would we accept that the person can be in company of someone? We're talking about confidentiality, but also to have a dialogue. Does an interpreter or maybe a member of the family that could play as an interpreter? Maybe sometimes the solution is near, but we don't take the time to question, because for certain people, they're going to prefer that this interpretation in their language being done by a member of their family. I'm going to take we have different dialects, and we talk about our health and how we feel. It can be very fragile, and also to speak about a member of our family that even if it's the best interpreter, if I don't know this person, I'm going to say everything, or if I am with someone else. So to see other ways of proceeding that could also inspire But of course, these are worries that we have and we're facing. The medical language is also is another world, could be a high pressure in the language not be able to reflect what the client is saying. So we have to consider also all of these elements in the interpretation and translation work. There are 5 centers where there's navigation of services as several in the Friendship Center to the request of the patient. That can be done. They may have access to someone coming with them, but it's not like that everywhere in all of the regions where the navigator of services are directly in the network. It's case by case. In Montreal, the reality, there are so many nations. Also, the complexity. I spoke about Trois-Rivières that was serving majority 3 different nations, but in Montreal, we have Indigenous nations that come from the west of the country, the east of the country. There are another Indigenous languages, but so the cares are specialized in Montreal as well. So there are more diversity. But these are important problems because it's a right. All humans to understand and be able to consent to the cares they need. It's also comes back with the CDP discussions. Kevin, I could come back the discussion in the discussion forum. Maybe there will be a sharing of other regions that have found solutions since our last meetings. Marie-Ève, did you wanted to react to what has just been shared, or is a new question? It's not Marie-Ève. It's Catherine Ladirage. I'm a Marie-Ève colleague. I'm working with the organization of mobilization of tables and local accessibility. It makes sense what my colleagues Julie and Audrey were saying, to have many solutions that we could gather together. One of the big projects that have mobilized people in the accessibility table was the need to have a line 24/7 with translation in many languages to mutualize interpreters in every region, and with a health network, because it's considered the regions that are better served than others. They could share all the work, and this is a project that is going to be brought during the year by many tables, so many members. So thank you for the accessibility table, but maybe it could be a way to collaborate and mutualize the resources. I would invite you to write to me. Maybe we could organize a small activity with the CDP. With pleasure. Thank you. Kevin, maybe would have the time for a second point, maybe not 3, but we can go with the second point. Thank you, Gabriel. My second point, how to design the relationship between the groups of Indigenous and health friendship and the Health Quebec. There is a Santé Quebec, a new actor within the ministries and the field teams. Santé Quebec, we have the structure of governance that's starting to be built after being in the procedures to integrate this structure officially, because we want to decolonize for the governance and the funding to be able to continue, but seeing the context. Do you believe that we have the means? Are there any relationship with Santé Quebec? The evaluation that we have done is with the first point about the funding, the relationships between friendship centers and the funding pass with the issues of the different regions. So this aspect that we have evaluated, it will be more my colleagues in the strategic development that could speak about this point and the structure of Santé Quebec. We didn't have to evaluate it, and it wasn't still present in the period of evaluation that we did. So I don't have the answer. Very well. Would you like to go to your third point? Yes, if I have the time. The third point about the co-construction and the integration of the users in the research. I understand that it takes time. I live the same reality. Your research project started in 2021. Now we're in 2025. You have to show us you just showed us the results. Do you have any advices for the integration of patients or users, Indigenous users in the process that we do? Or what is the perspective? When do you think we will be able to include them? As we were saying, we focus in the four aspects of accessibility, the collaboration, the governance, and the inspiring practices. So we didn't go up to the evaluation because the movement is very big. 11 friendship centers we didn't evaluate, but we are projecting for the renewal to go and see the effect. But I could talk to you about the initiative of because they had an evaluation process with the use of Abitibi. They go to the local scale, so they know what is the perspective to implement initiatives of evaluation of the clientele in the center. The results are going to come out soon, but I know they used many strategies to go and meet the clientele. They're not limited to the questionnaires. They did a mural where Indigenous peoples could express themselves artistically, like an artist. So it was a way to go and look for data collection, this practice that is very inspiring, and the results are going to come out soon. So I'm going to let you present them, but there could be important ways of doing things that implicate the users and Indigenous peoples who come looking for service, and another reflections that we want to explore on our on site. We did it in our pasture. We sit in the center. We are with them in the friendship center. So we see people, and sometimes we have informal discussions. We didn't put the accent this evaluation. We were more in a macro level. I would invite the prudence we have identified. There are general directions and friendship centers or people who have coordination positions. They find the spaces for co-construction. Imagine users that have a reality, and their contribution could maybe influence the care that they're going to have of the relationship. We have to take the time to build the relationships. And maybe in the chum, maybe are you there? But in Baldo, they went and they gather with the members, but they come to them in the friendship centers. We are not there in the chum. We need to be careful and not instrumentalize people so that they would feel used. If the space, if we haven't still, it's a little bit hard to invite all sorts of people that can contribute to this construction space. And we, for the next, with the friendship centers, even we at the observatory won't have the time. It's going to be brought by friendship centers and will be interested, will be able to reflect to the methods that would seem the most coherent and pertinent in their environment with the members of the Indigenous urban community in their cities. I'm going to support them and help them to do this data collection when they will be ready without breaking the trust with the users. So something to look at. It's so inspiring. I really hope that this would have answered your questions. Yes, I see the time. We are 10:56. I wanted to take a last minute to thank you, Julie and Audrey, for all the preparation for this activity. You have delivered this with a lot of braveness. Also, thank you to also the members of a community of practice. Thank you for sharing the invitation of this activity in your networks, in your teams, and also to the Indigenous partners with whom you work. Thank you to our interpreter that was translating during these 90 minutes. I shared the link of our next activity that will take place April 23 about cultural safety in the CHLC. We're going to have 3 initiatives that are going to be presented. I would invite you to register and to share the link in your networks. Thank you for your participation, Julie and Audrey. I would invite you to contact me when you would have new results to present in the community of practice. It will be with a huge pleasure that we'll be able to receive you. So have a great day and see you next time. Thank you so much.